Hello, I am Dr. Deepu Chankappa. Today we will discuss regarding post-COVID-19 symptoms or long COVID or post-COVID sequelae. Although most people with COVID-19 get better within weeks of illness, some people experience post-COVID conditions. Post-COVID conditions are a wide range of new, returning or ongoing health problems people can experience 4 or more weeks after first being infected with the virus that causes COVID-19. Even people who did not have COVID-19 symptoms in the days or weeks after they were infected can have post-COVID conditions. These conditions can have different types and combinations of health problems for different lengths of time. These post-COVID conditions may also be known as long COVID, long-haul COVID, post-acute COVID-19, long-term effects of COVID, or chronic COVID. Along with the experts around the world are working to learn more about short and long-term health effects associated with COVID-19 and the persons who get them and why only few of them are affected. We have different types of post-COVID conditions. The first one is new or ongoing symptoms. Some people are experiencing a range of new or ongoing symptoms that can last weeks or months after first being infected with the virus that causes the COVID-19. Unlike most of the other types of post-COVID conditions that may only tend to occur in people who have had severe illness, these symptoms can happen to anyone who had COVID-19, even if the illness was mild or if there was no initial symptoms. People commonly report experiencing different combination of the following symptoms: difficulty in breathing or shortness of breath, tiredness or fatigue, symptoms that get worse after physical and mental activities, difficulty thinking or concentrating, sometimes it's also referred to as brain fog, cough, chest or stomach pain, headache, palpitations or fast beating of the heart, joint or muscle pain, pins and needles feeling, loose stools or diarrhea, sleep problems, fever, dizziness on standing, this is called as lightheadedness, rash, mood changes, change in smell and taste, change in the menstrual cycle or period cycles. And second one is because of multi-organ effects of COVID-19. Some people who had severe illness with COVID-19 experience multi-organ effects or autoimmune condition over a longer time with symptoms lasting weeks or months after COVID-19 illness. Multi-organ effects can affect most, if not all, body parts, including the heart, lung, kidney, skin and brain functions. Autoimmune condition happen when your immune system attacks the healthy cells in your body by mistake, causing inflammation, that is redness of that particular area, painful swelling in those areas or tissue, and damage in the affected parts of the body. While it is very rare, some people, mostly children, experience the multi-organ inflammatory syndrome during or immediately after a COVID-19 infection. MIS is a condition where different body parts can become inflamed. MIS can lead to post-COVID condition if a person continues to experience multi-organ effects or other symptoms. The third most common post-COVID effect is because of effect of COVID-19 illness or sometimes hospitalization also. Hospitalization and severe illness for lung-related disease, including COVID-19, can cause health effects like severe weakness and exhaustion during the recovery period. Effects of hospitalization can also include PICS, that is post-intensive care syndrome, which refers to health effects that begin when a person is in an intensive care unit and can remain after a person returns to home too. These effects can include severe weakness, problems with thinking and judgment, and post-traumatic stress disorders. PTSD involves long-term reaction to a very stressful event. We have seen PTSD even with people who have seen an accident or persons who have seen someone committing suicide. Some symptoms that can occur after hospitalization are similar to some of the symptoms that people with initially mild or no symptoms may experience many weeks after COVID-19. Can be difficult to know whether they are caused by effects of hospitalization or the long-term effects of the virus or a combination of both hospitalization and the long-term effects of the virus. These conditions might also be complicated by other effects, including those related to COVID-19 pandemic, including mental health effects from isolation, negative economic situation, that is because of lack of earning and lack of access to healthcare for managing underlying conditions. These factors have affected both people who have experienced COVID-19 and those who have not. And now, how to prevent this post-COVID syndrome? One important thing is to not to get affected by COVID. So what to do for this? We have to get vaccinated. Till you get vaccinated, we have to follow 3 things: social distancing, masking and sanitization. If you do this and do not contract COVID, there is no question of post-COVID, which is a traumatic experience to many patients. Thank you.